I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Welcome to this episode of IDD Health Matters. Our guests today are Ricardo Ortega and Babar Navaz. Welcome.
Thank you.
All right. So both of you work with an organization specifically related to the field of health for people with intellectual and developmental disabilities. So who wants to go first in telling us about the field?
Yeah, so
Or about what you do?
Yeah, so we are a electronic health record system for providers. So providers who support individual with intellectual disabilities, they need a electronic documentation management system / electronic health record system, and to do all of the above, to provide support, care, meds, daily ADLs, goals, activities. So we built the system 11 years ago, 12 years ago, and we are now in 25 states.
Very good. I'm sure there have been some challenges in getting a system that works in this field, because we know that there are some specific documentation components to this field. Can you speak to some of the challenges and the way you've maybe overcome those?
Yeah, so the biggest challenges are compliance. So, and especially when you go to each and every new state, they have their own set of requirements. They have their own set of billing requirements, attendance, funding, all the way down to assessments and how things are done on a daily basis. So those are the biggest challenges. Every time we tap into a new state or go into a new state, we do partner with a customer who helps us actually customize and develop the system according to that state initially, and then we just basically start selling into the other providers. So the way we overcome is seek help from one of the providers or customer who signs up with us, and then they help us and guide us through the process. And matter of fact, the entire system actually is, I jokingly say, is built by our customers, because we listen and we develop the system how they want it, from DSPs all the way to managers to coordinators and nurses to executive directors. So we listen to all of them, and then we build the entire system.
Well, that makes the system work for the customer.
Exactly.
Which is what you want to do.
Exactly.
So, Ricardo, what's your role in the field in this company?
Yep. So I am the director of sales and marketing. Started with iCare Manager mid-February of this year, 2023. But
It's only been that long?
yeah, it's
Really?
yeah, feels like it's been a while.
Yeah.
But as you know, spent the last 13 years on the pharmacy side,
Right.
serving providers, supporting individuals with intellectual disabilities. So it's been a phenomenal 8 months.
Yep. And what would you say is unique to this field that's maybe a little different than other aspects of healthcare?
So with any industry, you're going to have challenges, but I think what makes this industry unique is depending on the state. So I live in Texas. Texas is one of the kind of lower funded states. And so you have challenges with funding, and then you have challenges with staffing. And you're working with professionals that are trying to support individuals with those challenges, staffing and funding. And so finding staff to do the job at the rate that they're provided is one of the key challenges that I see. And so working on the electronic health record side, what's exciting for me is we are going into organizations and trying to streamline processes to make them more efficient and give them more time to provide healthcare.
Well, you led right into the question that I was going to ask you guys is, how does what you do as a company affect that in a positive or negative way?
The positive thing is that it gives a lot of time back to the providers to spend their time on the right thing. So before a documentation management system 5 years ago, 15 years ago, we will spend like 8 hours or 6 hours doing daily documentation to stay in compliant, and only spend 2 hours on providing the actual service to the individual, spending quality time with the individuals, supporting those individuals. So within a good documentation system, now that 6 or 7 hours has been cut down to maybe just an hour a day. And now you focus on the real job, which is providing the service to these individuals.
And I can speak from experience on that. When EHRs were really first coming online in the general healthcare world, not just in this field, it was challenging to learn. They were challenging to learn. They were challenging to work. They worked in the way that the programmers thought they should work, but not in the way that we really all needed them to work. So that's why I really appreciate what you said, that your customers built the tool because you listened to them.
Yeah. And one of the most important thing is that we built the system bottom up. Most of the systems that you see out there are built from top to bottom. And what I mean by that is we kept the DSPs and all the other team members who are the frontline workers or frontline people who are doing bulk of the data entry in any system. So we built a system keeping those team members in mind and made it very easy, simple. And then, then we built all the other systems, modules and reporting and everything else. And because of that, and that is one of the reasons for our success, is because it's the adaptability is really high. So DSPs or managers and coordinators can quickly learn the system and be up and running in a few months and start putting data. And then the data that goes up to the management is clean, meaningful data because it's being properly documented at the front line. So
that's extremely valuable when you're on the providing services side of things, to be able to have a system that does what you need it to do, that provides data in a way that makes sense, that's usable, and takes care of the requirements aspects of all the documentation that we have to do as well. Yeah.
And gone are the days when technology was really complicated. Now, if you know how to use a phone, you should be able to document things. You should be able to pass meds. You should be able to do daily goals and activities.
We're a lot more savvy with using electronic things now than we used to be as well, too.
Exactly.
Yeah. So, we didn't even talk about the company. What's the name of the company?
It's called iCare Manager.
iCare Manager. And if people want to learn more about it, how do they find you?
Yeah, so if you can come to our website, iCareManager.com, we support 3 types of customers. Of course, individual IDD providers. Then we also have a suite for assisted living, long-term care, and then we also have a case management suite as well. It is a one-stop shop solution for providers. It has from individual tracking to goals, activities, med passing, assessments, all the way to fleet management and daily maintenance, those type of things. So, and clock in, clock out. And that's one of the other reason we're seeing a huge success in IDD, because it is a one-stop shop system. So it's a very comprehensive system. So right now we do learn that providers are using 6 different systems to do 6 different things. We have consolidated everything in one system. So there's one login for your staff, for yourself, either you're a maintenance guy or your fleet management guy, or you are a nurse, or you are a doctor, or you are a manager. One login, it has everything in it for you.
Wow.
Yep. So iCareManager.com.
So let me ask you this. What's the future? Where do you see this field going in terms of documentation and systems like yours?
So in the past, I will say maybe 6 years, 5 years, I am seeing a huge improvement. Technology is changing, so as people's mindset are changing, people are more receptive towards adopting new technology. There was a fear of technology fear before, like, oh my God, when am I going to lose my job? How am I going to learn the system? That is actually going away now. So thank God for that. So in next 5-10 years, it's going to get better and better and better. And with now AI in the picture, it's going to be even more amazing. So the future is looking pretty amazing.
So what's your thought on AI?
I think it's
game changer.
Game changer. When you, depending on what type of AI you're talking about, some of the Elon Musk YouTube videos, he talks about going to the extreme. But I think for most organizations, AI is going to be the tool that's pulling out data that's just obscure or not being looked at, and really reporting on things. So hopefully in the next few years, adopting AI for eye care manager is going to make nursing assessments,
Yep.
QA very, very easy. Having AI embedded into the system, you're able to find different things, different data points. So if an individual started a new medication, 30 days ago, and you've seen a spike in seizures since then, it can go back 30 days and say, this was the new occurrence. The individual's been pretty steady with their seizures, and there's been now a 40% increase. So using AI to look at all the different documentation that's happened over a year, 2 years, or even further, and really finding, okay, this is unique, because you're able to look back at the data and see what it shows.
And one of the thing, let me add a few things. That was what he says excellent, is that what we are looking to do in our system is that, right now, creating an IP or PCP for an individual takes a lot of hours. So goals, activities, all that stuff. So the AI in future will be able to give you a final version of a individual plan if you know the bio, if you know the history, if you know the diagnosis for the individual, what his likes and dislikes are, what he wants and needs are, his family members, his history. So if you have all that information in a EHR system like ours, it should be, or it will be able to produce you a amazing plan, and then you press a button and the plan gets implemented, and then your team then just runs with it. So that is the plan in the next few years.
To be honest, this is exciting, but it's a little scary.
It's scary.
Because I can see, someone saying, okay, create a treatment plan for this person, and, based on records, but we're going to have to have person-centered thinking AI is what we're going to need, where we make sure that person and what they want for themselves is a part of it as well.
And you'll be surprised to hear this. Sometimes AI is more intelligent than you and I.
Oh, I'm sure of that. Because that doesn't take much.
So what happens is what's going to happen is it's going to give you a lot more very detailed plan. Somebody still has to modify you. So before you press that button, it has to be reviewed by the right person. So we're still, our job is still secure.
Okay, good.
We're still going to be able to sign off.
We've got to have that human touch in there.
We've got to have the human touch, but the ideas it will give you how to help somebody find a job is going to be amazing. The ideas it's going to give you that, maybe we should try this as a strategy to help him behavior. It's going to be amazing. And then you can pick and choose. I like this will work with him, but this may not work with him, and take it off. So it's going to be much faster.
It will be exciting to see for sure.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So one of the things I like to do at the end of each program is ask people to tell us 3 things that they would like the world to know related to improving health, wellness, or supports and services for people with intellectual and developmental disabilities. So you can do the 3 between the 2 of you, or you can each give me 3, whatever you want to do. But just 3 tidbits that you think are important for people to keep in mind.
Generally, or just for the IDD side?
For the IDD, yeah.
First thing is that we want to, whatever we can do to help these individuals be part of the community. Either it's helping them find a job or, helping them at a family event or whatever. So, treat them normal. Treat them like as you and me. And you can go with the number 2 while I think about the number 3.
Yeah, I when I think about this industry, I just think about myself and my kids, right? And just the same things that I would want for myself and my kids, just being able to pull out of them their goals, their dreams, their wants, their wishes, and really cater to what they want and find how we can help them get there. And so that's, I think.
And one other thing, it might not be, related, but if you get an opportunity, there's a huge need. All these are nonprofit organizations. They're doing a phenomenal job providing residential, day employment services, supported living services, all these services to these individuals. And we heavily rely on funding, when it comes to other, private funding events or through Medicaid funding. So if anyone listening, if you guys, be part of any of these organizations, and we all have a donation button on our website, go and donate money. It will be, very helpful to these organizations to provide support to these individuals.
All right, Babar, Ricardo, thank you so much for sharing what you do in this field and your insights. And it'll be interesting. I don't know how I'm going to interview an artificially intelligent system, but one day I might have to do that as well too. But thanks for what you for taking the time to join me today, but also for the work that you do in this field.
Well, thank you, and same
Appreciate it,
Craig. Thanks to you. Thank you for doing everything.
Thanks.